Today, we are privileged to have with us a distinguished speaker and my respected teacher, Dr. Usman Mehboob, who is an associate professor at the Institute of Health Professions, Education and Research, Khyber Medical University, Peshawar, Pakistan. He has a doctorate and DHPE and fellow of the Higher Education Academy, UK. He is fellow of Foundation for Advancement of International Medical Education and Research, USA. He has a postgraduate certificate in accreditation and assessment from UK, and he also has also won CMI Leadership Award for his management and leadership skills. So without further ado, let's extend our gratitude to Dr. Mehboob for gracing us with his expertise. Over to you, sir.
Thank you, Dr. Fizzah. Let me share my screen. Okay, so today, thank you, Dr. Fizzah, and I thank CorTeach for giving me this opportunity to interact with my colleagues from different professions. Today, I'm going to talk about ethical and legal implications of artificial intelligence in medical education and research. As Dr. Fizzah has introduced, I am Usman, and I'm working as associate professor in medical education. So is my voice okay? Because I think Dr. Farooq is struggling with my voice. Okay, so probably I think for some of our colleagues, it's a bit, I'll be a bit loud. I'm sorry, I had a very bad sore throat for the last 2 weeks. So I'll try to be at the top of my voice and my teacher's voice. Fine. So let's start with our overview of this next half hour talk, and then we'll have some time, around 15 minutes or so, for question and answers towards the end. So initially, we'll talk about artificial intelligence and its ethics in general. And the topics that we are going to talk about is biased AI, artificial intelligence in the court of law, artificial intelligence creating arts, and then the use of artificial intelligence in autonomous cars. And then we'll be discussing artificial intelligence ethics in medical education. And towards the end, we are talking about the human rights, but towards the end, we'll be talking about the rights of artificial intelligence and what are its rights and how we shall be addressing it. Fine. So let me check my microphone settings. I don't know why the voice is not good. Let me check. Just give
Sir, it's fine now. The voice is fine now.
Okay. Is it slightly improved now?
Yes.
Okay, that's good. So I have put the microphone at its maximum. So let's hope that it should sort it out. Fine. Okay. So let's talk about artificial intelligence ethics in general. And the first area that we are going to discuss is the biased artificial intelligence. And we are going to also look into some of the examples of the biases in artificial intelligence. So I was searching for greatest leaders of all time. And this was one of the first hits that I got, that this is the list of all the greatest leaders of all time. But now, when we talk about the greatest leaders, is there any such thing as one list of greatest leaders, or greatest leaders are contextual, are cultural, are political? And these are all, you can say, human constructs. And these human constructs, they are from their socio-cultural background. And that data is fed into internet. It is fed into, and that data influences the artificial intelligence, because artificial intelligence, it works on data sets. So let's look into another concept. And then I search for schoolgirl, and these are the images that I got for schoolgirl. And now when you look into these images, and you can do it yourself as well. You can just play with Google search, and you can also give it these options. And then I search for schoolboy. And these are the pictures that I got for schoolboy. So you can see the difference and the way we think and the way we develop our searches, and how does it influence the search engines. So what is biased AI? We all have biases of the real world. And the question over here is that how can we ensure more equalized and accurate results? So what is gender bias, and how does these gender biases of humans, it influences artificial intelligence and our searches on the internet? And then the question that comes in is that, can we report these biased search results? And what would or should be the accurate representation of women in these search results? So you saw the greatest leaders, and you saw all majority of the names that were all related to one gender. We had Mother Teresa, but that was probably just one name over there. So these are the real human biases that are affecting the data, and that is affecting the search results. Now let's look into another concept, that is the concept of artificial intelligence in the court of law. So probably let me clear the screen. I think someone has switched on the annotates. So, let me stop annotates. So the question over here is that, would I want to be judged by a robot in the court of law? So this is a question that I ask myself, and I also encourage you to ask yourselves. Would you like to be judged by a robot, or would you like to be judged by a human judge? And let's now further discuss this. Artificial intelligence, Dr. Fizzah, if you can please manage the annotate option, because I think some of our colleagues, they are struggling with, and they're just maybe playing with Zoom. So if you can just stop the annotates. Thank you. Okay. So artificial intelligence, it evaluate cases and apply justice in a better, faster, and more efficient way than a judge. I mean, we are playing with generative AI, and we know the power of generative AI, and it can reach to, it can give us suggestions in much better and more faster way. It can analyze the data much quicker than us. So there is automation of the justice. Artificial intelligence, it also increases efficiency and accuracy of lawyers in both counseling and litigation. AI-based informed decisions, they are devoid of any bias and subjectivity. As we know that we as humans, we have biases and we have subjectivity, and artificial intelligence would be probably not as biased as the humans. But then there are some ethical challenges that we also need to discuss over here. One of the challenges is the lack of transparency of AI tools. Artificial intelligence decisions are not always intelligible to humans, because these are algorithms, quite complex algorithms, and most of the times we are not aware of how these algorithms they are working. Another ethical challenge over here is that we just discussed that artificial intelligence is also not neutral. There can be inaccuracies because it depends on data. There can be discriminatory outcomes that are embedded or inserted biases. So these are the ethical issues around which we need to think about the use of artificial intelligence in the court of law. And then there are new concerns for fairness and risk to human rights and other fundamental values. So the way we negotiate the human rights, as I said, that ethics is quite embedded in our socio-cultural values. And these socio-cultural values, sometimes artificial intelligence may not be appropriately using the socio-cultural background. So this is again an area, a concern that we need to think about. The third concept that we are going to discuss here is the artificial intelligence as an author. So, who is the author? That's the question. And the case study that we have is that in 2016, Rembrandt painting, the next Rembrandt, that was designed by a computer and created by a 3D printer 351 years after the painter's death. And this all was based on the painter's data, and all his pictures, they were fed to the computer. So the question over here is that who can be designated as the author? The company which orchestrated the project, the engineers, the algorithm, or the real painter whose paintings were actually used to create this painting, that is Rembrandt himself. So then let's move on to another fourth concept, that is a general concept of autonomous cars. And the ethical question over here is, who would you choose to hit? And I'll be linking it to our undergrad medical education as well, when we would be given these sort of dilemmas in our forensic medicine. So let's look into its details. So the situation here is that driver brakes avoiding hitting a walker and making a moral decision to shift the risk from the pedestrian to the people in the car. Imagine an autonomous car with broken brakes going at full speed towards a grandmother and a child. By deviating a little, one can be saved. So the decision is not by a human driver, but car's algorithm. And the question over here that we also used to get was, who would you choose, the grandmother or the child? So maybe on the right side, you have grandmother, or maybe if you deviate slightly left, you can hit the child. And who are you going to hit? So again, it's the algorithm that is going to make the decision, and the algorithm is going to make the decision the way it has been developed, the way it has been fed. So what will be the situation in this case? And that's a question for all of us to think about. So let's now move on to a more specific topic that we are going to discuss, that is artificial intelligence ethics in medical education. And some of the ethical concerns that we have in health professions education are around data gathering, anonymity and privacy, consent, data ownership, security, biases that again we already have talked about it, but now we are going to talk about biases in context of health professions education. Then comes the concepts of transparency, responsibility, autonomy, and beneficence. So I have also given the references at the end. You can just read these concepts in detail from their relevant sources. So let's look into the first concept of guarding against excessive data collection. So there are these passive hidden data gathering that is always done by the different softwares, and there is an ethical requirement, a single click for terms and conditions, and we all almost on everyday basis or weekly basis are if we download an app or something, and there is a long list of terms and conditions that we never get a chance to read, and we just agree with it and we just go ahead, and then there is this passive data gathering from our devices, from our mobile phone, from our laptops. And then another risk over here is the risk of apophenia, that is finding spurious patterns and relationships between random items. And these were some of the basic statistics teachings that we teach our students at undergrads about the spurious correlations, the correlations that actually are there, but they do not make any sense. For example, the sales of banana are high, as well as there are a lot of people dying in that city. And the common thing actually is that it's a metropolitan city. So that's why bananas also are selling more as compared to other cities, and people are also dying more as compared to the rest of the cities. It's not because the people are dying because of bananas, it's just because it's a metropolitan city. So these sort of relationships, they are quite dangerous. And a suggestion over here is that we shall have institutional protocols for active and passive data gathering in health professions education. And we also need to revisit our ethics approval requirements in terms of research and teaching data. So at the moment, we do have research ethics committees, and they are looking into how we collect data, and they then question it. They look into all the principles of ethics. But we do not have any such ethics committees for teaching data. And there is a lot of teaching data that we are collecting, and we are going to talk about it in the other under the other topics as well. So then comes the question of protecting anonymity and privacy. And there is risk of data de-anonymization with AI capabilities. As you all know that when we are collecting data, so we just anonymize all the participants, and we would probably just name them A1, A2, B1, B2, or some other code, so that they are not recognized. Especially when we are doing qualitative research and qualitative data analysis, and if we are using artificial intelligence, then there is a risk of recognizing patterns that can lead to de-anonymization. Another issue that we can also face is with third-party tools. That also increases the risk of student anonymity. So we do use third-party tools with learning management system. We use a lot of plugins, and they then require registration and identification, and that can be linked to any data that is supplied by the students. So again, suggestions are that learning management system and other teaching system data, there should be no cross-referencing. And one of the suggestions is that we just, at our institutional level, we deny any third-party access to any tracking of data from the LMS or any other apps. And then another thing that we can do at institutional level, usually what we do is that we usually issue emails either on name. For example, it's my name, Usman.Mehboob @ of my university, or maybe it's the student's roll number. So one of the suggestions is to issue non-identifiable email addresses for students that they can use on external systems so that it cannot be tracked back to them. Uh, Another issue that we are going to discuss is ensuring full consent. Again, as I said, that we collect a lot of data at our institutions from our LMS. And are the students aware that we gather this LMS data? And then the question comes in, have they given consent? And to what have they actually consented? And has that consent been given voluntarily? Usually the students do not have an option. They have to use the LMS anyways if they join an institution. So again, as I said, that we need to have not just research ethics board, we also have to have education ethics boards. And they should ensure that the student consent for active and passive data gathering that is collected from them. And another issue that we also see is that we have to protect the previous students, because a lot of students' data is used by the institutions for their evaluations, for their performance, how they can increase their finances, and all these aspects. And that is something that we need to discuss in our institutions, how we are going to protect this students' data. Then comes the issue of guarding against data and algorithm bias. And we have already talked about it in the journal principles of ethics, journal issues. As we know that data is dominated by demographic identifiers, or there can be underrepresented cultures or races or genders as well, maybe because of disabilities, or maybe some age groups are underrepresented or overrepresented. So algorithms are formed and they reflect the dominance and underrepresentation, and that is again one of the issues. Another issue about these algorithm biases is that we have stereotypes in health professions education, and that stereotyping is incorporated into artificial intelligence. As I said, that artificial intelligence, it is built on data, and then the algorithms, they also, based on that data, then they just have their own decisions based on that data, its own reasoning. And that can lead to inappropriate algorithms. So inherently, it can be racist, or it can be sexist, or otherwise prejudiced. So this is algorithm bias. And its impact can be on staff and student recruitment. It can impact their promotions, awards, internship, course designs, and other preferences as well. So a suggestion is that we have to have diversity in our data. But just to be mindful, size alone does not guarantee diversity. So diversity should be in terms of all these demographic variables that we identify. So the next issue that we are going to discuss is ensuring the transparency of the algorithm. So we know that algorithms, they are not transparent. That is, again, one of the issues. And another issue is that these algorithms, they are not inspected. One of the things that we are always comparing, we are doing a lot of studies on artificial intelligence, and we are more concerned about the results, not the methodology to measure the success of different AI tools that we are using for our academic and research purposes and teaching purposes. For example, Google Translate, and I'm sure most of you would have used it, and it's extremely efficient. But the system, it does not actually know any of the languages it translates. It simply works with the data. So what are the suggestions? The suggestions are that health professions education institutions, they will need to ensure that all algorithms that are used are well documented. And it's better to go for open source or to use algorithms that have been rigorously tested on wide scale. So just to uh, be ensure that it is transparent. And another suggestion is that we have to relate these artificial intelligence systems to our educational theory, because that's the foundations of our teaching and learning and assessment and curriculum development and overall educational environment. So we need to look into these algorithms from perspective of educational theories. So another question area that we are going to discuss is ensuring appropriate beneficence. So what is beneficence? We study about it, autonomy, beneficence, non-maleficence, and justice. These are the basic principles that we always talk about. But what about in context of artificial intelligence? So one of the concepts of beneficence is that we shall acknowledge and reward our data suppliers. And who are actually our data suppliers in health professions education institutions? It's our students who are mainly our data suppliers. And another ethical concern that we need to discuss in our institutions is that the students, they must be protected from the use of data against them. So this is something that we need to ensure. Another issue around beneficence is that institutions, they draw more revenue from new students and donors because of this student data. And again, it is the responsibility of the institutions that they need to be mindful about the use of the data and how they are going to use that and with whom they are going to share it. And another question that we need to discuss in our institutions is that if there is any restitution or payback for students whose data we are using to increase our revenue. So one of the areas that we also need to think about is preparing for artificial intelligence to change our views of ethics. So far, all our views of ethics are based on, as I said, it's embedded in our history, our culture, our society, and it's a human concept. But how artificial intelligence is going to change our views. So as AI advances, and if you all recall from 90s, maybe we would have heard this word singularity. We used to hear about this word in movies. And this is what is singularity? It's greater than human intelligence. And AI is going to advance to that level. We even in just 1 year time, we all can see the advancement that is there in artificial intelligence, especially generative AI. So ethics, as I said, that it is grounded in our own reason. It varies over time. So our ethical values, they keep on changing, and they also vary from culture to culture. And artificial intelligence, it will recognize these shortcomings in our ethical models, and it may adapt and develop its own ethical models. As we have this autonomy, beneficence, biomedical ethics, autonomy, beneficence, non-maleficence, justice, and mostly our decisions are based on these 4 ethical principles. But what if AI develops its own model of ethical thinking? And educational ethics will be challenged by artificial intelligence views on ethics. And how does AI develop its modeling? And as I said, that the last topic that we are going to discuss is the rights of artificial intelligence. So preparing for artificial intelligence as a person with rights. And you can see one of the news clippings from last year. Suspended Google engineer says that artificial intelligence he believes to be sentient hired a lawyer. So there is an opposing discussion about the artificial intelligence rights and protections. And the question over here is that should artificial intelligence be protected by the same copyright laws that protect humans? As you know that we did not have the concept of animal rights few decades back. And then this concept of animal rights came in, and now most of our colleagues who are doing their research in basic sciences and laboratory sciences, they have to get a special permission, and they have to go through specific trainings after which they can then have their experiments on animals. So similarly, this concept of artificial intelligence and what sort of rights it shall have. Then the next question that we can think about is which other basic human rights will be granted and how this will be affecting health professions, education. For example, we are using virtual patients. So would virtual artificial intelligence students and patients have the right to decline to participate? Would research on these artificial intelligence students and patients require IRB approval? So these are some of the things that we also need to start thinking about. And I'll encourage my colleagues over here if they can maybe research these areas and they can think about and they can start discussing it with their colleagues at their institutions. So talking about AI, artificial intelligence, sentience, emotions, and feelings. Again, there is no universally agreed upon definition of these emotions and feelings. So this is again something that needs to be explored. And what rights will come with artificial intelligence, emotions, and feelings if virtual students and patients have it? So what sort of rights are we going to give it? So these are some of the areas that we can think about, because the way it is progressing, artificial intelligence, and the way it is advancing, there might come a stage where it will have, at the moment, we know that if you ask ChatGPT or some other these algorithms, these chatbots, they usually say that we are programs and we do not have any feelings and emotions, because if they say it and if they are allowed to say it, probably then the owners and the makers of these chatbots, they will be having issues. And you can see one of the issues over here, that one of the engineers, he was suspended because he reported that AI was having emotions and feelings. So some of the solutions that we can start discussing in our institutions is that, as I said, that we have research ethics committees, but we also need to have education ethics committees, or maybe we can train our research ethics committees. We can also educate our research ethics committees about artificial intelligence, and if we are researching on artificial intelligence, what can be the ethical issues and concerns. Initially, I remember almost a decade back when we started a medical education. So the ethics committees, usually they would be more concerned about invasive procedures, and they would be asking our colleagues in clinical sciences or basic sciences why you want to draw blood or something like this. But when our projects, they would go, so they would not be discussing about, they say, okay, fine, they are just having interviews or focus group discussions or maybe collecting some survey data. because the ethics committees at that time, our research ethics committees, they were not aware about the psychological issues that we can have, or other issues, socio-cultural issues that we can have in our social research. But now they are more aware, so they now discuss these issues when our research projects. So similarly, regarding artificial intelligence, our ethics committees and our research committees, they can discuss the issues and concerns that may come in near future. One of the suggestions can be that we can also have some ethics or AI ethics officers who should be guiding the AI policies relating to education and research. We should also have full disclosure notices about institution policies on gathering, storage, and sharing of the students as well as the faculty and other staff data as well. So there need to be a full disclosure at all institutions. And we shall also have policies on the use of AI systems by faculty and students, what we can do, what are the do's and don'ts of these different AI systems that we have, and how can we use it for our research, how we can use it for our educational purposes. So there need to be a clear guidelines, and I think some of the countries, they have already developed, other countries are in process, institutions are working on it. I'm aware of some of my colleagues. I'm also one of the members of one of the groups that is working on developing these policies and guidelines. So I think that's pretty much all from my side. We have around 10 minutes or so for any question answers, and I can see a lot of questions that we have. But I think probably Dr. Fizzah, you can help me with questions, and then I'll be
Yes, sir.
answering.
Thank you so much. Thank you so much for your insightful presentation, your expertise and thoughtful exploration of the ethical consideration in AI have been truly informative. Um, we have we don't have much questions over here, but there are some things I want to ask you for, like for the discussion. How would you address the ethical challenges linked to Chat GPT in student assignments, considering aspects like bias, privacy, and the responsible implementations of AI?
Thank you, Dr. Fizzah. So I think one of the things that I'm also advocating to my colleagues is that it's just like when in 60s or 70s when the calculator came in. So with calculator, uh, there was a lot of issue by mathematics teachers, and they said that the teachers, they will be done. But in 10 years time, we realized how to use calculators appropriately. We will be stopping students from exams, not to bring calculators and not to take help. But now we allow them. We encourage them to bring in their calculators, and they can use it for complex mathematical solutions. So similarly, I think the best strategy is to adapt artificial intelligence in our academia and in our research. It's just like we did not have PubMed, or we did not have these online databases. So in 70s or 80s, our supervisors who are now retired, they would tell us that we would be spending months in libraries, and then we would be sending requests to London, and the books would take weeks to come in, and so that we can use them for referencing. And we would have a typewriter. But now the way you people do your PhDs, they have become extremely easy, because you just sit in front of a laptop, and for 2-3 years, you do not get up from in front of your laptop, and you are having access to all the databases and everything. So all these tools, they are just advancing the way we research, and they are making it more efficient. So I think we should be encouraging artificial intelligence. Rather, probably, I think because one of the pictures I still remember that I saw probably 10 years back, And in that picture, education was lagging behind, and it was just trying itself, and it was clinging to the feet of technology. The technologies was advancing and education was, and we still see this old schooling system that we have. I think we need to adapt. I think we need to encourage the use of artificial intelligence, chat GPT or Perplexity or Bard or Gemini. And we need to inform our students that please use these tools and then reflect upon it, how these tools have made it efficient, how they efficiently help you in solving your assignment. So, and also appropriately tell us all the steps. So we need to tell them what is plagiarism and what is not plagiarism. So what is original thinking and how they are then using these tools to further improve upon their originality and creativity. So I think we as educationists, we should be bold enough to encourage the use of these generative AI tools in our assignments, and probably we should not be afraid of it.
Thank you, sir. There is another question. Can you please explain how to check the reliability of the data derived from AI?
Yes, you are very right. Excellent. So, as I said that, for example, you have asked your students maybe to do your assignment on educational theory or application of educational theory in medical education, and you have asked them, encouraged them to use any of the generative AI tool, maybe Bard or Gemini or Perplexity or some other Pi or Chat GPT. So there are many other tools available. And so the job of the students is then to verify the content. That is important for us. So I was maybe a few weeks back, I was preparing some workshop and I was using Illicit, and I was checking all the PDFs, because if it is coming from your PDFs, if you have to ensure that it comes from a proper, authentic, and credible source. And with Bing, I think you can see that Bing and Gemini, they also now give you references. So what I usually do is that then if I'm interested in some point, I'll just go to its original source to see how that point is written over there. And this is what we also used to do. For example, if I'm reading a systematic review or a scoping review, and I am trying to find some gaps in, let's say, patient care education or maybe clinical reasoning. So what I would do, I would maybe go to reference number 34, and then I would open up reference number 34, its original PDF, and then I'll further read it in details. Okay, fine. The gap was written in the scoping review, but that gap was referred to this reference number 34. So now I need to go to reference 34, what was actually said in that reference about this gap from that original study. So how it was mentioned over there. So this is what we used to do as well. And this is what we need to do with generative AI tools.
Can we take another question?
Yes, please go ahead. We still have time.
WESTME has declared that AI cannot be mentioned as authors of articles. I want to know, I want to ask, is it justified to use AI in peer reviewing and not disclosing to editor?
Again, you have to follow the journal policies. Almost 70% of the journals at the moment, they discourage the use of artificial intelligence in authorship or in peer review process. So if you are maybe, let's say, peer reviewing for Nature or for maybe some other journal, so you have to see their policies. If their policy is stopping you, then again, it's not ethical to, it's not professional to not follow their guidelines. So, but if the journal, and these journals are going to accept it, they are still struggling. As I said, that education and research, they are lagging behind, and they're just trying to cling to the feet of the technology, and technology is advancing. So We educationists, one of the problems with educationists is that they're quite orthodox in their thinking. They are quite old school in their thinking. So, and it takes them time to adapt and to change, although we do encourage change and adaptability, but we ourselves are quite resistant to change. So we need to be, I think, encouraging, but as you said that at the moment, you have to follow the journal's policy, whatever the journals and the institutions and the program policy. As I said that I myself want to encourage the use of artificial intelligence, but I am also part of a program. And if my program, if my university, they are not permitting it, if they are not allowing it, despite, whatever I think, I still have to follow the policy of my program and follow the guidelines. Although I do advocate for the use of it, I do talk about encouraging our students to use it, but still, I have to work under the umbrella of my program and under the rules and regulations of my university. So that's, I think, a simple answer to the question.
Thank you so much, sir. As we draw near the end of this interesting session, I want to express my deepest gratitude to Dr. Usman Mehboob for sharing his valuable insights and expertise with us. The recording of this session will be shared with you. And I would also like to thank all the participants for their time and active participation. Thank you for being a part of this enlightening webinar. I look forward to see you all again soon. Until then, take care and stay connected and have a nice day.
Thank you. Bye. Have a nice day.